All right, well, thank you for joining us today. Welcome. My name is Dana Howarth. I'm the Deputy Director of the New Mexico Caregivers Coalition. We're a small nonprofit located in Bernalillo, New Mexico, but we've offered training and resources to family caregivers and paid care workers across the state of New Mexico and on the Navajo Nation, thanks to our partnership with the Sotso Foundation and Valerie Sotsi. Valerie, want to say hi?
Hi guys, I'm glad you guys made it this time. I know we were really excited and glad that we were able to get this rescheduled. So super excited to learn, about dogs today. Maybe I can get a support llama. Just kidding.
Thank you, Valerie. I don't want to take any more time up from our guest presenter. We're very thankful to have that we were able to reschedule today's session. Before I pass it on to her, just a quick note, if you could keep yourselves on mute when just to kind of limit the background noise for the recording, that would be appreciated. If you have any questions, you're welcome to drop them in the chat during the presentation, and our presenter will get to them during the portion of the presentation where the Q&A is. So without further ado, introducing Gemini Shell with the New Mexico Governor's Commission on Disability.
Thanks so much, Dana. I appreciate it. I'm really glad to be here, everyone. Thank you all for attending. I have to apologize for my having to reschedule. I got COVID last month, so I was down and out for a little while. But I'm glad to see everybody here today to talk about this topic. It sounds like it's a pretty popular one, so I'm glad we're recording it for anybody who isn't able to attend today. It's a busy time of year, I know, summer and vacations and such. So I'm going to go ahead and jump in here. I'm with the Governor's Commission on Disability. I am responsible for a variety of different topics, including service animals with the GCD. I also run some programs and things like that. Service animals is one of the ththings that I talk about most actually in my job. So I'm happy to be here and pass some information on to you all. Actually, I'm going to go ahead and stop my video just so we can focus on the slides here. I'm going to share my screen. And then I'm going to turn off my video and we'll get started. Thanks again for being here. I'm so happy to see you all. All right, so first, whoops, hold on. Knew I was going to do that. There we go. Okay, so first, I just want to say a few words about the Governor's Commission on Disability. Some of you might be familiar with us. We're also known as the GCD. As you can see here, our work is driven by the mission of equal access, removal of barriers, and improving the quality of life for citizens of New Mexico who have disabilities. In support of this mission, we run several different programs that you see here, some of which you may have heard of before. We have the RAMP program that does home modifications, the Quality of Life grant that is for small nonprofits around the state. We have an NMTAP, which is Technology Assistance Program. And we also have the Brain Injury Advisory Council, also called BIAC. In addition to the programs we run, the other services we provide include technical assistance, training, and then advocacy on behalf of individuals who are facing barriers related to disability. We provide these services to state and local government agencies, employers and nonprofits, higher education institutions, and also the general public. So thanks again for asking us to come in and talk to you all. We sure appreciate being able to provide information whenever we can. But as you can see, our contact information is here. And as a reminder, my direct contact information is on the first slide. And I'm happy to answer any questions about service animals or other issues that might pop up. We have a lot of information, a lot of experts in our agency, and we're happy to help in any way we can. So here's our agenda for today. First, we're going to talk a bit about some of the laws that are related to service animals, including the Americans with Disabilities Act and the Fair Housing Act. We'll also talk briefly about the New Mexico Service Animal Act. Then we're going to move into what I like to call sort of a deep dive on service animals under Titles 2 and 3 of the ADA. Then we're going to talk about the Fair Housing Act and assistance animals in housing. And we'll talk actually also a little bit about animals in medical facilities. And then we'll finish with some resources that I pulled together to provide to everybody. So the laws we're going to be talking about today are really focused on the Americans with Disabilities Act, or the ADA, the Fair Housing Act, and that one that I mentioned earlier that's kind of sometimes forgotten. A lot of people don't know about it in New Mexico, but we do have the New Mexico Service Animal Act, or otherwise known as the NMCC. One side note that you might need to take into consideration, we're not talking today about public transit services. But they are covered under DOT regulations. And if you have questions about that, go ahead and just give me a quick call or send me an email. Okay, so first we're talking about the Americans with Disabilities Act. The ADA is actually a civil rights law. I don't know if you are aware of that, but it's a civil rights law that was passed in 1990 and it was amended in 2008. It has 5 titles. Different sections are referred to as titles, and you see those listed here. Title 1 is employment. We're not really talking about that today. Title 2 is state and local government, including all services that are provided to the public by any of those entities. It also includes public higher education. It primarily deals with the programs and services that an entity provides. And that's going to include physical spaces where those programs and services happen to. So the programs, services, and the spaces in which those programs occur. And then Title 3 is public accommodations. That's going to include businesses and nonprofits, medical facilities, private schools, hotels, sports stadiums, etc. This covers all private commercial entities, so anything that's not governmental. Title 4 is telecommunications, and then Title 5 is kind of a jumble of different topics related to the ADA. And again, today we're primarily talking about Titles 2 and 3 in relation to the ADA. So the ADA specifically defines disability, and that is a physical or mental health impairment that substantially limits one or more major life activities. But that's not all. It also includes a person with a history of such an impairment, a person regarded as having such a disability, and then also, interestingly, it also covers a person associated with a person with a disability. So as a caregiver, you might actually fall into that last category, if not any of the others. That last category, you are associated with a person with a disability, then you're also covered as under the ADA as a person with a disability. So just a few examples. A person with a history of disability, specifically, might be someone who is in remission from cancer, for instance. A person who's regarded as having such a disability might be a gay man who is rumored to have HIV, but in fact does not. And then a person associated with a person with a disability, as I mentioned, might be you as a caregiver who works with someone who has a disability. And again, this definition actually applies to all the titles of the ADA. So it also applies in employment under Title 1. Now we'll move on to Title 2, that's state and local government, and then Title 3, public access or private entities, public accommodations and private entities. The Department of Justice enforces Titles 2 and 3 of the ADA. And then the titles actually also share a definition of what a service animal is. And that is a dog or a miniature horse, and we'll talk about that in a little bit, but a dog or a miniature horse that is individually trained to perform tasks or work for the benefit of a specific person with a disability. You have to note that the definition only applies to Titles 2 and 3. Title 1, which again covers employment, does not have a definition for service animal. And it's a very different conversation. We're not going to get into that today, but it is one of the funny things about the ADA, that the definition of service animal only applies in Titles 2 and 3. Now, the ADA requires all state and local governments, businesses, nonprofits, really anyone that provides any programs, goods, or services to the public to make what's called a reasonable modification to policies, procedures, their facilities, et cetera. And that is specifically to accommodate people with disabilities. And again, that phrase is reasonable modification. In this case, allowing a service animal entry to someplace that doesn't allow pets normally or animals normally is considered a reasonable modification of a no pets policy. So that's where that reasonable modification comes into play, specifically related to service animals. Now, you may have heard that the laws about service animals and housing are different, and that's true. We'll get into that more in depth in a little bit, but generally speaking, the Fair Housing Act is the law that covers housing and the animals in housing, and it is enforced by the Office of Fair Housing and Equal Opportunity under HUD. It defines what it calls assistance animals. And again, this isn't, they don't define service animals, they define what they call assistance animals under this law. And that is an animal that works, aids, or performs tasks for the benefit of a person with a disability, or, and this is a big or, that provides emotional support that alleviates one or more identified effects of a person's disability. It also specifies very, very clearly in the definition that an assistance animal is not a pet. So you can see here that the definition of an assistance animal actually differs considerably from the ADA definition of service animal, in that it also includes emotional support animals. And then we get to the New Mexico Service Animal Act. This was passed in 2013 and it updated a previous 1978 law that was related to service animals. Unfortunately, the NMCC does not have really any effective enforcement. You might say it doesn't have teeth. It's very difficult to bring a case against somebody under the New Mexico Service Animal Act. The law, though, it does follow the ADA. It includes the definition of a service animal, and that's the same as the ADA. But importantly, it actually adds some other requirements or provisions. It protects service animals in training, which the ADA does not actually do. So if someone has a service animal that is not fully trained yet, they're still considered a service animal under the New Mexico Service Animal Act. It also makes it unlawful or for an unrestrained animal to interfere with the work of a service animal. And finally, it also makes it unlawful for a person to misrepresent a pet or an emotional support animal as a service animal. That's actually really important because, as you may know, there's really kind of a rampant misrepresentation of pets and ESAs as service animals, and it really impacts people who have qualified service animals in a very negative way. So we try to discourage that. Now we're going to focus our attention on service animals under Titles 2 and 3 of the ADA. So this is where we get into that deep dive. Again, not to kind of beleaguer the point here, but I'm going to reiterate that a service animal is a dog or miniature horse where reasonable, that is individually trained to perform tasks for an individual with a disability. In other words, this animal has to engage in recognition and response. Some people call it R&R. Its tasks are not passive, such as comforting anxiety, for instance. The tasks performed must be directly related to the disability. So for instance, if someone is deaf and they have a service dog, and that dog is only trained to open doors, then that's not a task that is directly related to the disability of that person. So that wouldn't really be a qualified service animal. That person can have a service animal that would be an alert animal, though, that alerts them to sounds, for instance. Importantly, you cannot exclude a service dog just because of its size or breed. That's something else I want to really point out. There are 100-pound Great Danes and 5-pound Chihuahuas, and they can both be service dogs. We'll discuss that a little bit more later. First, before we get too much further into this, I wanted to show kind of a side-by-side definition of the different types of animals that we'll talk about a little bit today, or a lot today, I guess I should say. As we know, a service animal is a dog or miniature horse that's been trained to do tasks for a specific person with a disability. It has full public access rights. That's really important to understand because that sets it apart from the other types of animals. It's full public access rights under the ADA. That means you cannot exclude it from any space with public access, except in very specific situations that we're going to get into in just a little bit. And most of those are actually related to healthcare. So this can apply to you directly. Now, an emotional support or comfort animal, on the other hand, is any animal that provides passive support to a specific owner with disabilities. It has limited rights under the Fair Housing Act and is covered under the definition of assistance animal. Again, we'll get further into that soon. In addition, emotional support animals may be allowed under Title I of the ADA, the employment, which I mentioned earlier. I'm not going to talk too much about that, but it's interesting to note that emotional support animals can sometimes be covered in employment settings. Now, assistance animal is a term that's used under the Fair Housing Act. Again, I gave you the definition earlier, and it includes both service animals and emotional support animals. And then finally, there's something called a therapy or facility animal, and that's usually a dog that has been trained to sort of behave well in a variety of settings. They respond well to many different types of people and environments. And usually they actually have also completed certification training, but they don't have any public access rights under any existing laws. Anybody, any facility that uses them brings them in under their own rules and regulations, and it's not public access in the way that, say, a service animal has public access and has a right to be there. Now, I wanted to include a quick note here about the miniature horses that are allowed under Titles 2 and 3, because often people are kind of perplexed by this. It is a little bit unusual, but miniature horses range from about 70 to 150 pounds and about 24 to 36 inches high. This means, generally speaking, that most service horses are going to be about the size of a medium to large dog. Additionally, they can be trained to do basically anything a dog can do. And also, really importantly, and this is kind of the crux of it in some ways, they can often provide 20 years or more of service to a handler, whereas an average life for a service dog is closer to 7 or 8 years. So you can see if you go to the trouble and expense of training a service animal, it might be worth your while to have a service horse instead, miniature horse specifically. And it does have to be that specific breed. It can't be a pony or anything like that. It's specifically a miniature horse. Also, they're very strong and they're great for pulling wheelchairs, for instance. They also have a very calm nature. And it is important to note that they are subject to the exact same rules and considerations as a dog under the ADA. We're going to get that deep into that in just a minute. So sort of back to some basics. What do service animals actually do? You might be familiar with some things like a guide dog for the blind, but there are lots of other types of tasks that can be performed as well. Important to note, they function as an extension of the person with the disability. Basically, that means that they are going to be able to provide a task or perform rather a task or provide a service that the person with the disability is unable to perform themselves. That might be, an example might be someone who uses a wheelchair can't get from place to place without that wheelchair. Similarly, a person with a service animal cannot do certain tasks by themselves, and the service animal is required to do that for them. Some people actually even call service animals a tool or assistive technology. Broadly, again, service animals promote independence in daily living activities, in and out of the home. So that's going to be in public, sometimes in work situations, and then of course at home as well. Now, here's where we get deep into what types of tasks animals can perform. In the past, as I mentioned, service animals were often really mostly thought about as guide dogs for the blind, but service animals can be trained to perform really almost as many tasks as you can think of. Here are a few examples. As we said, they can guide people who are blind or low vision. They can alert people who are deaf or hard of hearing. They can also pull wheelchairs, open doors, or retrieve items for people with mobility disabilities. They can alert people with certain medical conditions to the impending onset of a medical event, such as a seizure or high or low blood sugar, for instance. And you might actually hear this type of dog called a medical alert animal, a medical alert dog. Additionally, there are psychiatric service dogs that can remind someone with that type of disability to take their medication. They can stop them from self-harming, or they can assist them during a panic attack by providing deep muscle pressure, for instance. Laying on their chest is one way that they do that. We're also seeing a lot more service dogs for individuals with PTSD, and there are lots of veterans starting to use service animals for that condition. But it's not just veterans. It's PTSD dogs can be for anybody with PTSD, of course. And then finally, I just want to make an important point, which I made earlier actually, but I'll say it again. Service animals can be any size or breed. You cannot exclude specific sizes or breeds because of concerns that are not related to the behavior of the animal that's actually right in front of you. So for instance, if a facility or a city has a pit bull exclusion, it does not apply to a service animal. They cannot exclude a pit bull who is a service animal. It's also important to remember here that it's often not obvious what task the animal performs, and the disability is also often invisible. One example I like to use is a tiny dog that's held in the arms of its handler. At first, you might assume that this is a pet or an emotional support animal, but you can't assume because, as I said earlier, a 5-pound Chihuahua can be a service dog. Small dogs that are held near the face can actually alert a handler with diabetes to low blood sugar better than a larger dog that has to be on the ground. Okay, now we're on slide 18. That brings us right to our next point. How do you tell the difference between a service dog and a dog that's not a service dog? How should businesses and clinics and other entities tell the difference? How do you identify a qualified service animal? According to the Department of Justice's guidance, it's actually really clear what you can and can't do and what you can and can't ask in order to identify a service animal. First, importantly, if the disability and task are obvious, such as a blind person using a guide dog, you actually may not ask any questions. You're not going to learn anything you don't already know just by looking at them. So don't ask any questions. But if the disability or the task are not obvious, you can only ask 2 questions. First, is this animal required because of a disability? If the person answers yes, then you move on to question number 2. What task or work has this animal been trained to perform for you? If the answers to the questions clearly indicate both A, a disability, and B, an active task, you may not ask any more questions. We're going to talk in just a couple minutes about what an active task is. There are active tasks and passive tasks, and that's a key. So if you're working with a client or a family member who has a service animal as defined under the ADA, it's important to know that businesses, clinics, and hospitals, et cetera, may not do any of the following things. They may not ask the person about their disability or for proof of a disability. They may not ask for service animal certification, registration, or paperwork of any kind. Additionally, there are some organizations or businesses that sell certification paperwork online. It's important to know that those documents don't convey any rights whatsoever under the ADA, and the Department of Justice does not recognize them as proof that the animal is a service animal. So if you are a caregiver for someone who wants to buy a certificate online and buy a little vest that says ESA or even service animal, just tell them that they don't have to do that. It's not a requirement, and it's really a waste of money in a lot of ways. Some people find that it's helpful because they can so there's such a misconception that a vest and certification is a requirement for a service animal that that they get it anyway just because it makes it easier for them to move from place to place. But it's not a requirement under the law, and it doesn't convey any rights under the ADA. So they also can't ask to have the animal perform the task. So keep in mind, some animals, they can only perform the task in certain situations, such as a dog that senses an oncoming seizure. Of course, you can't ask that dog to perform its task when there's not an oncoming seizure. You can't ask for any other proof of training either. There are two other things to remember here. Service animals in training are protected under the New Mexico Service Animal Act, as I said earlier. And then also, service animals do not have to be professionally trained. A handler can train their own animal. Someone who's disabled can train their own animal to do the tasks, perform the tasks that they need performed. That's often something that's very surprising to a lot of people. People think that you have to get an animal professionally trained. There are certain tasks that if you don't have a professional trainer, it's going to be very difficult for you to train your own animal to do. But in general, you're not required to have professional training. Additionally, those entities cannot require that the animal wear a vest or ask why it isn't wearing one. Again, the ADA does not require it. And then they definitely cannot restrict where the animal is allowed to go. As I mentioned earlier, this is service animals have public access. If the handler or public in general can go someplace, so can the animal. There are very few situations where you can exclude a service animal, and we'll talk about those in just a minute or two. And then finally, they cannot charge a fee except in very specific circumstances that we'll also discuss in just a minute. I do actually want to pause here for just a minute to point out some important considerations. Not all people with a service dog, a qualified service dog, will use the technical ADA language to define or describe their animal. They may actually refer to it as an emotional support or therapy dog, but this is where that second question comes into play. The business or the clinic, that public entity, must ask this question, the second question, because finding out what task the animal performs, if any, is their key to understanding if an animal is actually a service animal. Action verbs like alerting, pulling, pushing, warning, opening, scanning, walking, etc. Those are going to reflect service dog tasks. Also say retrieving is a good one. These require recognition and response. Passive verbs like comforts or calms, they usually reflect emotional support animals. But it's also really important to remember that people with service animals actually also do experience comfort and calming from their service dogs. So again, businesses need to be asking that second question, and they need to listen for those action verbs. Okay, now when can a service animal be excluded? Every service animal handler has rights and responsibilities, and every government or business entity has rights and responsibilities as well. So here are the reasons an animal can be excluded. First, if the presence of the animal would fundamentally alter the nature of the service or program being offered. An example of this would be a hospital where the handler was having surgery. It's very arguable that the presence of the animal in an operating room would compromise the sterility of that operating room, because of course the surgery requires a sterile environment. So that would fundamentally, or could fundamentally alter the service that was being provided, the surgery. Importantly though, to note that animal would have to be allowed really basically everywhere else in the hospital that the handler is allowed, including their hospital room, the cafeteria, etc. And then second, if the animal is out of control and the handler does not take effective action to control it, now a bit of barking is not considered out of control. And for some animals, part of their task may actually be barking. So for example, alert animals. But if the animal is persistently barking and won't stop and it's not related to a task, you can ask it to leave, or it can be asked to leave. If the animal is aggressive toward anyone, they can also be removed. And if the animal is damaging property, they can be asked to be removed. And then third, an animal that is not housebroken can be excluded. That kind of comes into play more with, say, a service animal in training that's covered under New Mexico law. Most all service animals are very well house trained. Very importantly, though, if a service animal is excluded, the handler must be allowed to return without the animal and participate in the programs and services offered by that entity. So if a business says your dog just had an accident in the aisle of my grocery store, and you need to take it away and leave it outside, then the person who handles that animal, the person who's disabled, must be allowed to come back in. You might ask, well, some people can't come back in without their animal, and that's true, but they must be allowed to come back without the animal. And then here you can see a little photo I included of a white curly-haired dog. They have a service animal harness, and they're standing next to a restaurant table. They're trying to eat a waffle off of a plate. You might assume that this is never okay, and that's true, it's never okay. That animal could be asked to be removed. Okay, now those service fees can't be charged for the animal. Any fee that would also be charged to another person without an animal can actually be charged to a service animal handler. So that's going to include admission fees and things like that. If there are pet fees, though, in some place, then the pet fee cannot be charged, because again, a service animal is not a pet. If the service animal causes damage, however, to say a space or a physical environment that it's in, the handler can be charged for those damages. And then other points to note here, the handler is responsible for all care and supervision of the animal, and the animal should be vaccinated according to state and local requirements. But in an ADA Title II or III setting, you can't actually ask for proof of vaccination. We're going to get into that a little bit more in the Fair Housing Act section because it's different under the Fair Housing Act. Okay, now the handler also has some other responsibilities. The service animal must be under the control of the handler at all times. As I mentioned earlier, it must be under control. Most of the time, this is going to mean that the animal must be harnessed or leashed or tethered in some way. But if the handler is unable to use these tools due to a disability, say they don't have use of their hands, for instance, or if it would interfere with the performance of the animal's trained tasks, say the animal retrieves things from across a room, then the animal should be under the handler's control through voice, signal, or in some other way. All right, now we're going to move on to talk about the Fair Housing Act and animals in housing settings. And here's our second deep dive, and we're going to talk about assistance animals now, because again, assistance animals are what are referred to under the Fair Housing Act. They don't recognize service animals in the same way that the ADA does, in other words. As I mentioned earlier, an assistance animal is an animal that works, aids, or performs tasks for the benefit of a person with a disability, or that provides emotional support that alleviates one or more identified effects of a person's disability. And again, an assistance animal is not a pet. It can be either a service animal or an emotional support animal. under the Fair Housing Act, both types of animals fall into the assistance animal category. Assistance animals do not have to be dogs because emotional support animals don't have to be dogs. So that's a huge difference between the ADA and the Fair Housing Act. So how does the Fair Housing Act actually apply in the housing situation? An assistance animal in housing is going to be considered a reasonable modification of the no pets rule. So again, that's similar to the ADA, and the ADA has reasonable modification wording as well. Very similar. In some ways, they mirror each other a little bit, the ADA and the Fair Housing Act. Now, an assistance animal in housing is considered a reasonable modification of the no pets rule. This is similar, again, to how service animals are covered under the ADA. But again, this is an interesting and important point, and it's a little bit confusing. So if you have questions at the end, please ask. The term assistance animal is a blanket definition under the Fair Housing Act for animals that would be considered both service animals and ESAs. But the Fair Housing Act, it's a blanket definition, but the Fair Housing Act actually handles qualified service animals differently from emotional support animals. So if an animal is a qualified service animal under the ADA, it's handled differently under the Fair Housing Act from an emotional support animal, even though both types of animals are considered assistance animals. So like I said, it's a little confusing. I'm going to be doing some repetition here in the next few minutes because there's a lot of similarity, but there are some differences. So in housing, service animals, again, we're talking about service animals, animals that qualify as service animals under the ADA. Under the Fair Housing Act, they must be handled the same as they would be handled under Titles 2 and 3 of the ADA. So essentially, a landlord has to follow ADA rules for a service animal in housing. They cannot ask for proof of disability or for documentation of training. They can't charge pet fees, exclude them from public spaces. They can't require vests or other identification. They can't restrict the animal or the handler to specific units in the building or facility. A service animal in housing can be excluded only if the animal is not under control or if it poses a direct threat to others. So it's just like you would handle a service animal under the ADA. Although a landlord can't charge any pet fees for the animal, they can charge any fee that they would also charge another tenant without an animal. That's also similar to the ADA. Additionally, if the service animal causes damage to the physical space or environment, they may charge for those damages as well. So again, if they're in a house and a service animal, a qualified service animal, damages carpeting by scratching it or something like that, the person can be charged to replace that. Other points to note, again, the same as the ADA, the handler is still responsible for all care and supervision of the animal, and the animal should be vaccinated according to state and local requirements. But here's where there's a difference with service animals. Under the Fair Housing Act, the landlord can require proof of vaccination only if they ask for vaccination documentation for all animals on the premises. So that means if a housing facility, apartment complex, et cetera, is pet friendly and they require all pets to show vaccination, proof of vaccination, then they can ask a service animal to show proof of vaccination. Again, under the ADA, entities cannot ask someone with a service animal for proof of vaccination. But the Fair Housing Act is different, and you can, or landlords can ask for that documentation. Now, we'll talk a bit more about emotional support animals under the Fair Housing Act here. First, and again, very different from service animals. Again, we're talking about ESAs now. Very different from service animals, a landlord can ask for proof of disability for someone who's requesting an ESA as a reasonable accommodation or reasonable modification. Generally, this proof is going to be in the form of a letter from a physician or a mental health provider stating that there is a condition that rises to the level of disability. And that letter needs to also explain how the animal alleviates one or more symptoms of that condition. So this is like the big difference between how the Fair Housing Act handles service animals and how it handles emotional support animals. This documentation about the diagnosis or the disability cannot be asked of from someone who says they have a qualified service animal. The landlord can ask those two questions to verify that it's actually a service animal. But if that person says they have an ESA, an emotional support animal, or comfort animal, that landlord can ask for proof. I think I'm on the wrong slide, sorry. There we go, I'm sorry about that. The landlord can ask for verification of a disability, and then also that letter needs to explain how the animal alleviates the symptoms, or at least one symptom of that condition. Then we get into the areas where there is a similarity between service animals and ESAs. The landlord cannot ask for proof of training. Again, there's no training for ESAs. There is training for service animals, but they can't ask for that either. They cannot ask for certification or registration. Again, there's none that's official, but many people might buy certifications online. They can't charge a pet fee. We talked about when they can charge, and we'll talk about that again in a minute. They can't require a vest or other identification. They cannot restrict the animal and the handler to specific units either. So if it's a service animal or an ESA, again, remember the Fair Housing Act specifically states that an assistance animal is not a pet. So if they restrict pets and people with pets to certain units in the facility, they cannot do that with a service animal or an emotional support animal, because the Fair Housing Act specifies that, that an assistance animal is not a pet. Now they can exclude, again, only if the animal is not under control or if it poses a direct threat to others. They can in some cases though, and this is different from service animals again, they can in some cases restrict an animal from certain public spaces, and that's going to have to be decided on a case-by-case basis. Let's say someone has an emotional support cat and they want to take it into a public gathering area, and that public gathering area is somewhere that people bring their pet dogs. They might have to say that the person with the emotional support cat cannot bring that cat into the public space, because it would fundamentally alter the nature of that public space for the other people who have dogs. And again, just like with the service animal, a landlord can't charge any service fees for the ESA, but they can charge any fee that they would also charge another tenant without an animal. So again, that's going to include things like deposits, security deposits, things like that. Those can be charged for both service animals and emotional support animals, those assistance animals, assistant animals. But they cannot charge pet fees, because as I was just saying, neither of those types of animals, assistance animals, are not considered pets. So they can't charge a pet fee. They can't charge a pet deposit, nothing like that. They can't charge more for the monthly rent because somebody has an ESA or a service animal. None of those types of charges are allowable. Again, if the ESA causes damage to the physical space or environment, they can charge for those damages. And just like service animals, the ESA handler is still responsible for all care and supervision of the ESA, and the ESA should be vaccinated according to state and local requirements. And again, as I said earlier, the landlord can require proof of vaccination as long as they ask for vaccination documentation for all animals on the premises. So that provision regarding vaccinations applies to all assistance animals, which again, all assistance animals includes both service animals and ESAs. Okay, Now, I just wanted to take a minute to talk about medical facilities, since many of you care for people that have to go to clinics and other medical facilities, possibly even really regularly. If your client has an emotional support animal or a service animal, this is important to note. First, you should know that clinics, hospitals, short-term care facilities all must follow the ADA and allow service animals, but they do not have to allow ESAs. So that's a difference. Again, ESAs are really only covered under the Fair Housing Act and in housing settings. All provisions of the ADA apply in medical facilities, however. And then I started to talk earlier about this. I did mention it. We'll talk about this a little bit further. Now, service animals can be excluded from areas that must maintain a sterile field, such as operating rooms, burn units, some ICU rooms, not all, but some ICU rooms, and then certain other areas similar to this. If a handler is checked into a facility, they must be allowed to have the animal with them. However, if they cannot take care of the animal due to their condition, the handler must make other arrangements, such as having a family member or caregiver come to the facility to relieve and feed the dog. Potentially, the dog may need to go stay with someone off site, or in some cases, they may even have to go to a kennel if there's no one else to take them from the hospital. In some cases, if a service animal handler is admitted to the hospital and cannot care for the animal, and there is no caregiver or family that can come and help or take the animal, sometimes the hospital will actually check the animal into the kennel. They'll tell the person that they're doing it, but they'll actually check the dog into a kennel on behalf of that person, since they can't take care of it. One important thing to remember, though, just like other entities, the facility staff do not have to care for the animal. That's why it says here, and mentioning again, if they cannot take care of it, the facility staff does not have to take care of it, and other arrangements need to be made. A facility, and this is really key, something that happens quite often, actually. A facility may not exclude an animal, a service animal, because they believe their staff can perform the animal's tasks, or due to a perceived lack of need for that animal's tasks while the handler is a patient in the facility. For instance, if a person has a mobility disability and their dog pulls their wheelchair and opens doors for them, if that person is checked into the hospital and is not mobile, is not using their wheelchair actively, the hospital cannot say that the dog needs to go because the dog's tasks are not needed. That animal needs to be allowed to stay with its handler. Just because there's a perceived lack of need for that animal's tasks doesn't mean that the animal can be removed. And then in an ambulatory therapy setting, for instance, the animal should be allowed to be present during therapy sessions. The person isn't necessarily going to be able to function with the animal in that setting at that time if they're going through therapy. In other words, they might not be able to handle the animal while they're doing their therapy, but the animal should be allowed to be there. Just because, again, it's similar, just because the animal's tasks are not needed at that time doesn't mean that the handler and the animal should be separated. They should be in the same room unless it's absolutely not possible. Another example of that, there are some places like a cancer treatment center where people go to get infusions, for instance, and sometimes those could be considered areas where a service animal should not be because of sterility concerns. A person could be set up to receive their treatment in a separate room from other people. They could also, I've heard of some hospitals arranging for, or clinics arranging for an animal to be kept in a closed bathroom close by where the service animal handler is. And just for a short amount of time, of course. That would be, for instance, maybe if somebody was getting an MRI, they might not be able to have the animal in the room with them. And the animal could be tethered in a bathroom, and the bathroom could be closed to other people. So those are some sort of workarounds for some of these potential issues that sometimes come up in medical facilities. Really important note is that rehabilitation and discharge planning should include a patient's use of the animal. If a patient is going home and they're having physical therapy and they're not necessarily going to be able to handle their animal, that should be part of the planning for the discharge, is that trying to get the person back to the point where they can handle their animal again as quickly as possible, of course, within reason. But that's a very important part. Discharge planning, rehabilitation planning that doesn't include the animal when somebody has a service animal is not going to be as effective, of course. And it's going to potentially cause problems between the handler and the animal, because they won't be working together, and the animal could potentially start to lose its ability to perform tasks, especially for longer periods of time when they're separated. Also important, and I didn't touch on this yet, but this is a really important one under the ADA in all settings, not just medical facilities, but it comes up in medical facilities a lot. In all settings, fear or allergies are not valid reasons for an animal to be excluded. Unless, and this is a big unless the allergies rise to the level of disability due to their severity. So if someone is deathly allergic to dogs, it's unusual, but I suppose it could happen. If they're so allergic to dogs that their health is at risk, then that would be 2 people with a disability as defined under the ADA. And in that case, a reasonable solution must be found to ensure the rights and health of both parties. I do want to mention, you might think that this is not that common, but I just recently had a call from a woman who has a service animal, and she had an appointment at a new clinic. She wasn't a patient there yet. She was at a new clinic. She had set up the appointment, came in with her service animal, and somebody at the front desk immediately said, "You can't bring that dog in here. So-and-so is afraid of dogs. Is allergic to dogs, and you can't bring that dog in here. They can't be in the same building." And of course, she knew her rights, and she said, "I can bring the animal in here. I have full public access with my service animal. He's a trained service animal. He performs tasks. Those are the only questions you can ask. You cannot exclude us because somebody is allergic to him potentially." And they insisted. They ended up kicking her out of that clinic, saying that she was not listening, that she was not following instructions, et cetera, even though she was just trying to educate them on the law. And she ended up getting kicked out of that clinic, and she called our office to make a complaint. And just so you know a little bit more about what I do, when I received that complaint, I contacted that clinic and provided technical assistance on the law and proper handling of situations like that to the office manager. I offered training to them to try to get their staff up to speed on what they can and cannot do when someone presents a service animal, and training also on, of course, how to identify a service animal as compared to a pet or an emotional support animal. So again, fear or allergies are not valid reasons to exclude a service animal. Okay, now I did leave quite a bit of time for questions, but before we go there, I want to go over a few resources that I included on these slides. Oh, and I should mention, I talked to Dana at the beginning. I'm sorry, I forgot to send the presentation to her so she could disseminate it beforehand. But I'm going to send it to her when we're done here, and she'll send it out to everybody. So you'll all have access to this. In this document, these are hyperlinks to these different resources. So the first one is a handout on service animals. It's an overview of service animal law, and that is also available on our GCD website. Next, there are 3 different resources from the Department of Justice, all related to the ADA and service animals. They're different resources. I recommend looking at all of them because they each have a little bit different information. Some of them are a little bit more in depth than others. And then there is a document, the last one on this page is a document that is an explanation of the difference between service animals and emotional support animals. It goes over where each type of animal is allowed and under what conditions. And that document is from the ADA National Network. And if you don't know about the ADA National Networks, they're great resources for information. But of course, you can always come to us. Next is HUD's guidance on the Fair Housing Act and animals. I really want to point out that if you're concerned about a client or someone with a need for an animal in housing, go to this page. There are also at the bottom of the page really important handouts, papers, their guidance for landlords. So if you have somebody who wants to have an assistance animal in housing, refer them to this or help them get here, because this is critical information and it's something that you can actually print and hand to a landlord. It is absolutely the best guidance on how landlords should be handling requests for an assistance animal in the housing setting. Next, I wanted to share a copy of the New Mexico Service Animal Act, just because, again, so many people don't know about it. And it's a great piece of legislation for New Mexico. It's just really unfortunate that it's not really enforced. We're going to be working on trying to get more enforcement, I guess we could say, but it's difficult. I've talked to many people who have said that they've called the police. They've been turned away from a business, for instance. They've called the police to because they know about the New Mexico Service Animal Act. They know that blocking them from coming in with a service animal is actually considered a misdemeanor under the New Mexico Service Animal Act and is subject to fines and or jail time. So a person with a service animal knows this, calls the police to report this infraction of the New Mexico Service Animal Act, and the police refuse to come, or they come and they refuse to do anything. They don't understand the law. So that's what we're up against with local and state entities regarding enforcement of this law. It's unfortunate because it's a great law and not all states have it or something similar. Then here I've included a copy of a sample service animal policy that was put out by the Department of Justice. This is actually written for small businesses. So if you have a business or you work for a small business, this might actually be very informative for you. So for instance, if you work for a small business, it doesn't have to be super small either. This actually can go to quite large entities. I talked to a hospital in the southern part of the state and provided this document to them, and they actually put it in play right away, which was great because their service animal policies were very out of whack. But so you can see, I mean, it was a large hospital too, so you can see that large entities can use this document as well. But it's very informative. And then as a side note, if you do have a business and you want assistance adopting a service animal policy, please just go ahead and give me a call. I'll be happy to walk through that with you and give you feedback. Okay, so I'm going to turn my camera back on. That's all I've got for today, but I left a lot of time for questions because there are always lots of questions on this topic, at least in my experience. Do we have any questions, Dina?
We don't seem to have any yet in the chat. If anyone has any questions, feel free to drop them in the chat. I know this is a very large, like overarching topic. It can be very, very large topic for folks, and maybe not, maybe you're still, people in the audience are processing this information.
Mhm. Yeah, that's a lot. It's a lot in a short amount of time. It really is. So I understand that, you know, if people are going to be, like you said, processing the information for a while, I'm always going to be available for questions. Just contact me through email or phone. All that information is on the first slide.
One thing that's not a comment, but question, but is a comment in the chat, pointing out that they had never thought about service animals, especially on the reservation, and how that might differ from other areas.
Yeah, that's a tricky one, because reservations and the Navajo Nation are sorry, my mind just totally went blank. I know all of this because they're sovereign nations. Sorry, it's a little bit different. The ADA doesn't apply in the same way in a tribal setting on tribal land. If there's a public business on tribal land, I believe it would apply there. But for instance, for government agencies and entities, it would be very different. They don't have to allow that. I think a lot of them do and kind of follow similar follow along similarly to the ADA, but it's not actually something that is directly applicable in a tribal setting. That's something I've been trying to get more information on, actually, because it is a big question in New Mexico. And I'm having a hard time. There's not a lot of, there just aren't a lot of resources out regarding how the ADA applies in tribal settings. Again, if it's not actually on tribal land, it definitely applies. So if somebody is a tribal member who has a service dog and goes to a business that's off the reservation, then it definitely applies.
Thank you. To clarify for folks that are asking about the materials in the chat, Gemini is going to email me her slide deck after we end the presentation today, and then I will send it out to everyone, so you will get a copy of all the slides. That'll be sent to you via email. And in the slide deck is the links that Gemini mentioned in her presentation, so you'll have access to those as well. Right, those are all hyperlinks. All you have to do is click on it, and it should open right up. Someone else in the chat did want to thank you for sharing clarifying the difference between emotional support animals and service animals. I know a lot of times that does come up a lot of times in the public. Right. I think most everybody has probably seen sort of the proliferation of animals in businesses and grocery stores and all kinds of places. And a lot of them are wearing those vests that say service animal, for instance, and it's important to recognize and understand that doesn't mean that animal, that dog, is actually a service animal. They can buy those vests anywhere online. There are thousands of businesses online that sell those. And they'll also sell ID cards, which is interesting, and certificates as well. So just as a side note, in relation to the Fair Housing Act, I've had a lot of people call me saying that they were requesting reasonable modification to their housing with an assistance animal, and their landlord asked them to provide certification.
It's not required. It's actually against the law to do that. They cannot require that. So if you know somebody who is in that situation, refer them to me. Again, I do advocacy, and I can call an entity and a landlord and explain the law to them so that they can follow it instead of not following it. And hopefully advocate on behalf of that person with the assistance animal.
And another question in the chat is asking about the cost of service animals.
So as I mentioned at one point, service animals do not have to be professionally trained, but for highly specialized service animals, such as a guide dog or a seizure alert dog, those animals do need generally to be professionally trained. It's very difficult for an individual who is not trained to train a dog to do that themselves. So those dogs must be trained typically through or are typically trained through a professional training organization. The main one in New Mexico is service animals, assistance animals of the West. And they will train guide dogs and hearing alert dogs and seizure alert dogs. My understanding is that those dogs can cost upwards of $25,000. They cover part of that cost through just donations and such, but they do actually charge the handler, the person with the disability, a specific fee depending on the type of training that the dog is receiving. So for instance, I believe a seizure alert dog is something like $5,000. I can't remember for sure off the top of my head, but it's something along the lines of $5,000. And my understanding is that from my conversations with assistance dogs of the West is that there are certain programs in the state that can help pay for some of that expense. Sometimes insurance, depending on the disability and a variety of other things, sometimes insurance will cover part of the cost of a service animal being trained. It really varies, but there are ways to get them paid for. It's just, and the expense does vary quite a lot depending on the type of training it needs. But of course, there's also the alternative, which is a person could go to a shelter and adopt a very well-behaved dog and train it to perform tasks for them. And the only expense would be the adoption fee from the shelter. So, so that's the sort of the opposite spectrum there.
Yeah, I was also wondering about that because I have a family member that has epilepsy. And I know that when she looked into a service dog for that, it seemed a lot more expensive because they had to be trained specifically for recognizing that she could be, if she's starting to like have an issue, that the dog could jump in quickly and recognize those signs.
Yeah, so seizure alert dogs are very difficult to train actually, because as you can imagine, you can't necessarily recreate a seizure to try to train them. There are very specific approaches to that, and I don't know what they are, but I know that it's a very difficult task to train for.
Anyone else have any questions? I think I got through all the questions that were in the chat. Let me just scroll through to make sure I didn't miss any.
Ask whatever you want. I mean, this is a big topic, and if it's not something that you're very familiar with, there's all kinds of clarification that we can provide.
Let's see. Just some commentary in the chat. As caregivers on the Indian country, we should advocate and let our tribal leaders know that the need to adopt legislation to our members with disabilities.
Yeah, I would say that because there's so much gray area on tribal lands I think that's a really important point. In my last work, I worked in a higher education institution, and it was a tribal college, and we had students with disabilities who said that they came from, their home, and that they really had never had accommodations at all in their life, and even in public school they had very limited accommodations, some of them. So it's definitely, I would agree with that person that advocating on behalf of people with disabilities and tribal communities is a big topic and very needed.
Another question in the chat is, where would one go for assistance? This particular person, I think, is near Window Rock, Arizona.
Go for what? For a service animal to get one trained, or?
Jacqueline, could you specify? Are you asking about where to go for a trained service animal, or for assistance with a service animal? Or if you're looking for question, in potentially another advocate, maybe in the Arizona area, since Gemini works for New Mexico Governor's Commission on Disability. You could provide some clarification. Where to go regarding advocacy? Do you know if there's an Arizona Commission on Disability?
I believe there is. Not all states are organized in the same way. So, but my understanding is that basically every state has an agency or a commission that does something similar to what we do. They don't all do exactly the same things though. So it's something that you could look up, and they do typically fall under state agencies though.
For someone that lives on the border of the state, would they have to go to the state that has their address, or are they able to go get resources from the opposite state? Because I know it's really hard. A lot of times it's confusing because the Navajo Nation's partially on Arizona, partially in New Mexico.
Yeah. Well, that's an interesting question. If the person actually lives in Arizona, we could definitely give technical assistance regarding the national laws, so ADA, Fair Housing Act, and things like that. But we wouldn't necessarily be able to address any state level laws. So in that regard, it probably would be best to go to the agency that is in the state where you live. But if you're somebody who lives on the border and goes back and forth all the time, and is going to businesses in New Mexico, we can certainly give advice and information about those activities.
Jacqueline, did that answer your question? Or if there's more clarification that you need us to provide regarding your question, just let me know. I know a lot of times that comes up because we do, our organization is located in New Mexico, but because of our partnership with the So Foundation on the Navajo Nation, a lot of times we have questions about people in the Navajo Nation that do spend a lot of time on both sides, back and forth between the New Mexico side and the Arizona side.
Yeah, it definitely makes things a little bit more complicated. It's already complicated because it's tribal land, but then going back and forth between the two states, it basically means that there are three different governmental entities at play in that situation. So that's quite a complex thing to handle, definitely. But we would certainly do our best.
Are there any other questions? I don't see any other ones in the chat, so if anyone wants to drop one in the chat, feel free to do so. If it'd be easier for you to ask it out loud, you're welcome to unmute also. If that's easier for you to do that instead of trying to type in the chat, whatever works for you. We want to make sure everyone has an opportunity to ask any questions that they do have. We're very thankful to have Gemini here offering all this presentation, these answers.
Well, I'm happy to be here. And like I said, if you don't feel like you're quite ready to ask a question, if you haven't quite formulated it, my contact information is on the first slide. Just email me or call me, and I'm happy to go over that with you. And sometimes people don't even know what question to ask. You might have a scenario that you want to talk about and you don't want to type that all out. I certainly can go over all kinds of scenarios with you and work through it and try to figure out what the answer is. So we don't always have all the answers right off the bat. Sometimes we have to do some research and look into a couple different things before we can actually answer questions. I do a lot of research in my job, so I'm happy to look into anything that you might be wanting to get more clarification on.
Looking to see some reactions. Most of the people don't have cameras on, so I can't tell if anyone's reacting or not. But yeah, so also if I did get a request for the recording in the chat. The recording on Zoom does take some time to process. I probably won't get that out until Monday, because it usually does it could take up to an hour for Zoom to process in the cloud the recording, and obviously it's almost 5 o'clock, so it probably wouldn't finish until after the workday is over, but I will get that out Monday so everyone can I'll include it with the slides, that way everyone has Gemini's slide deck and the recording in case you want to rewatch the presentation, and maybe that will trigger some additional questions that you may have.
Yeah. Yeah, I like that idea.
It's a very great commentary. Cheryl did put in the chat that the Navajo Nation's in elections. This is a great time to actually bring up these issues to candidates.
Yeah, definitely a good time. Don't hesitate to reach out to me if you need anything at all. And it doesn't have to be just about this topic either. If you've got other questions, like I said, we're an agency that covers all areas and all laws related to disability. So if I'm not the one to answer the question, I'll pass it on to the right person. We also have other programs. We have the technical assistance program, the NMTAP. So if you know somebody with a disability who is struggling to perform certain tasks, you might reach out to me. I'll get you in touch with NMTAP, and they might have some solutions that they could provide for you to help that person who maybe needs help with mobility or help with technology, things like that. The NMTAP is a great program. And then we also have the RAMP program, the home modification program. It's on hold right now, but it will be coming back up online by the end of the year, I think. We're in the process of hiring some more people. We're quite understaffed right now, but we're hiring some more folks, and we should be getting the RAMP program back up hopefully by the end of the year. And that's a great resource if you know somebody who needs a ramp or needs a bathroom modification. Those are the two types of home modifications that we do under this program. Give us a call. I can help you navigate that process. Again, we won't be doing anything in terms of accepting applications until later this year. But if you know someone who's a wheelchair user and they can't get in and out of their house, we're somebody to contact about that. So keep us in mind.
If anything that Gemini just mentioned intrigues your interest, Gemini and her colleagues did do a presentation on overview of all the Governor's Commission Disability resources and services that they offer. And we do have a recording actually of that session that they did. I think that was in May, I believe. So if anyone if anything she said does sound interesting to you, you can also reach out to me and I'd be happy to send you the recording of that as well.
And I know NMTAP can do a more extensive presentation as well. I think the one in May was everybody did kind of a short blurb about what we do, but NMTAP could absolutely do a longer presentation on a wider variety of the tools that they have.
Okay, one last call for any questions if anything's come up before we end today's session. If not, thank you, Gemini. I appreciate your presentation and thank you for rescheduling. I think this is great information for us to be able to provide the caregivers that we work with across New Mexico and the Navajo Nation. So thank you.
Sure, I'm happy to be here, and thanks again for asking me. I'm always glad to provide training and assistance and whatever you need. We're an agency that's designed to be helpers. So just reach out to us.
Perfect. Thank you everyone for joining us. I know there were a few folks that did join late, so I'll make sure to get you all the copy of the recording of today's session. And thank you for joining us and spending your Friday afternoon with us. I hope everyone has a great rest of your Friday and has a great weekend.
Thanks, everybody. Appreciate it. Thanks, Dana.
Thank you. Bye.
Bye.